People should get really excited about IWWM that's going to be happening this year in Madrid. The whys are, it was 4 years since we had our last workshop. So much has been learned. We have some very critical questions that, are going to be addressed at this meeting. I think, the important questions that we face now are the role of chemoimmunotherapy versus BTK inhibitors. We have data that will be addressed, at the meeting. Which BTK inhibitor and for which patient? I think we have now a lot of data that will, factor into our decision making that will be presented at IWWM. What do you do with somebody who's progressing on a BTK inhibitor? I think this is such an important point because we're using now BTK inhibitors, in our patients. How do we manage the intolerant patient or one who's developed acquired resistance? And then lastly, the role of genomics. This is a disease where 95% of patients have an MYD88 mutation and 40% have CXCR4 mutations. How do we factor that into these mutations into our clinical decision making? These are all the important questions at IWWM, so lots of good reasons to come to Madrid.